Okay, so now we're going to take a second and talk about one treatment option for those mechanical causes of pain. You might know someone that has a slipped disc or their bones in their spine are not aligned, variants thereof. So, what we're looking at is potential cases of degenerative disc disease or spondylolisthesis, in which the Jenga blocks of the spine, if we call each of our vertebral bodies one of the Jenga blocks in the full tower, if there is shift of one of those bones from where it's supposed to be, and we take some pictures and it looks like there's a lot of motion, that could be an unstable spine. So for those patients, traditionally, we would send them to neurosurgery or orthopedic surgery to have a procedure done to fuse and fixate the spine. Fortunately, there have been a lot of advancements in technology and in medicine, and so we now have minimally invasive treatment options that can take care of the same conditions with maybe a smaller incision. And let me talk to you a little bit about that. So the way it's done is if we have our spine, two views, we have this ligament here called the interspinous ligament, which is very critical in keeping the bones in alignment. However, when those Jenga blocks, start to slip, what we want to do is help stabilize that, right? And so with proper positioning and under x-ray guidance, from a side approach, I can guide a small little screw between the spinous processes that helps keep that space open. And then more importantly, we can help fixate it, because once I get that screw across the spinous process line, I have these two wings that pop out. This may not be the most elegant, but you see how that screw pops out there. I'm going to get my hands out of the way. All right. So the screw pops out. And on the other side, then, we follow it with another piece to fix it together. Now that Jenga block, which was shifted forward, is stabilized, preventing it from further worsening, and more importantly, further putting pressure on those nerve roots, which end up with, the sciatica, the numbness, tingling, chronic back pain. So ultimately, taking a good look at the MRI, identifying the causes of your pain, and selecting the appropriate treatment options. That's our goal here at University Pain, whether we're treating your chemical, mechanical, or electrical pain issues.